I think the first, which is incredibly important to highlight, is that they are in systems that are really chronically underfunded and understaffed. So one of the major barriers is that we just don't have services that are able to hold the needs of those young people. And that is so difficult for young people and their carers, but it is also incredibly difficult for the staff working in those systems. So that is one of the major barriers, is that our services actually just aren't given the resources they need to support young people in care, often, not always, but certainly very often. But there are also barriers that are unique for young people in care. And one of them is that we know from our research, and we know from research other groups have done, that there are diagnostic and treatment biases against young people in care. Sometimes that's called diagnostic overshadowing, which is a term that came from the health field that we sometimes now use in the mental health field. And that might mean, for example, a young person is less likely to be assessed using standardized instruments to look at their needs, or they're less likely to have things like PTSD picked up on, and they might be overdiagnosed, for example, with things like attachment difficulties. And there, what we're seeing is that assumptions are made about their mental health because they're a young person in the care system, without there being really a thorough assessment of what their individual mental health needs are.